I'm Dr. Praneeth, medical gastroenterologist from Karimnagar. So today we will learn about IBD. So few points about IBD. So inflammatory bowel disease is a condition which is an autoimmune disease which is characterized by presence of blood in stools, and the patient usually has more amount of stools associated with mucus in these patients. Okay, so most of the patient usually go to a local consultant about these complaints, and they usually think it as an hemorrhoids, and they usually avoid visiting to super specialty. They usually take some local medications, and if there are any small hemorrhoids, they usually treat for those hemorrhoids, and they usually delay the diagnosis. Okay, so presence of any blood or mucus in stools and increase in the stool episodes, all these mainly we should focus on inflammatory bowel disease, and it is most commonly seen in young age, mostly 30 to 40 years of women. In both men and women it is almost equal, but women usually more suffer than men. So it is an autoimmune condition. So in these patients, when the patient usually has this blood or mucus in stools, they should consult a super specialty gastroenterologist, and they should plan for colonoscopy. And based on the colonoscopy, we can identify whether it is of Crohn's disease or it is ulcerative colitis. So again, ulcerative colitis is divided into three categories, whether it is proctitis, proctosigmoiditis, that is left-sided colitis, or pancreatitis. So each condition has different type of treatment. And another one, the most dangerous, is Crohn's disease. So Crohn's disease is another condition which usually has a very vulnerable lifestyle if it is diagnosed later on stages with strictures. So differentiation between these ulcerative colitis as well as Crohn's can be done easily by colonoscopy, and based on colonoscopy we can treat the patient with simple medications. Okay, and any patient complaining of recurrent abdominal pains, so pain since lasting about many days, and which is associated with loss of appetite, loss of weight, in these patients we usually suspect Crohn's disease. So simple abdominal pain also don't neglect it. So consult a super specialty and take good treatment. Thank you.
Thank you.